Hello ADC candidates, I am Mohammed Soliman, I'm tutor at Apeiro Training Institute. Today is just a quick short video for extraction forceps, to be familiar with what are the forceps to be used, because this is one of the OSCE tasks that come recently on the exam. We are glad actually that at Apeiro Training Services we have been giving this task since last year as part of our training for the ADC practical exam. And today will be showing you just different types of basic instruments for the forceps and how to apply it, what are the movements to do for the extraction. So mainly there is few points that you need to be familiar with when you come to this task. Which forceps that you are going to use, first thing. Second thing is the position of the Manikin, whether it should be supine or 45 degrees. Third point is the position of you as operator, from where you are going to stand in front of the patient or the Manikin. The fourth and last thing, or we can maybe before last, the fourth thing is the application of the instrument, the forceps, and the movement that you are going to use. Last thing, which is the number 5 point, which is the support with your left hand if you are right-handed. Okay, so let's start with the forceps. First, the selection of the forceps. So if you can come closer, you can see that we have different types of forceps. These ones here are the upper forceps. This one is upper anterior. This one is a bit curved for better access. This one for premolar. And we have two types for the molars. So the molars, you can see one part is round and one part is with sharp pointy edge. The sharp pointy edge, this part will be applied always to the buccal. So this one will be applicable to the patient right side, and the other one will be applicable to the patient left side, left upper molars. Okay, so these are basic forceps for the upper anterior, which is totally straight, upper premolar round in both sides but a bit curved, and upper right molar, upper left molar. For the lower, the basic forceps that we have are 3 forceps. Lower anterior forceps, which has the peaks actually pointing and touching each other, and then the lower premolar, which have a bit wider peaks, and the lower molar, which has sharp peaks on both sides. This is universal lower molar. It can be applied for both right and left molar. So second point we mentioned is the Manikin position. So always for the Manikin position, remember, it is usually when we do the extraction, we do it while we are standing up. So the Manikin should have to be in your elbow level, okay, to be on the same height of your elbow. And if you are doing upper extraction, it's always supine is the better position. If you are doing lower, we'll put the Manikin into 45 degrees position like that. All right, so if we are doing upper, we'll put it supine. If lower, we'll put it 45 degrees. Point number 3 is the operator position. For operator position, it is usually variable, but some positions are more common than others. So usually 7 and 8 position is good for most of upper teeth. All the upper teeth you can do it from this position that I'm standing on. It's 7-8 position. You can go a little bit shift into 8 is like that. 9 is this way. So 7-8 position will be good for all upper anterior and also for lower left molars. So lower left molars, when we put the mannequin 45 degrees. From 7-8 position will be a good actually point accessible for this side. When we come toward lower anteriors or lower centrals, it is better to access that from behind the patient, which is 11 o'clock position. So this way. For 11 o'clock position, it will be better to do lower anteriors, lower centrals and laterals while you are on 11 o'clock position. The same when you go around the whole area here, you can go into the same position. You can move a little bit toward 9 o'clock position if you want to do a bit more toward the back molar teeth on quadrant 4 here, in quadrant 4 in lower right side. All right, so this is all about the positioning of the operator. We mentioned 7, 8, 9 also can be used in some areas, and 11 o'clock position. So next point number 4, the application of the forceps and the movements. So we can start, most of them are similar, except just some exceptions. So for upper anteriors, we use the straight forceps. Always for all the movements, we apply first an apical grip. This is actually our LA mannequin, so I don't want to ruin it. So I just will assume that I'm applying it. So we do always apical grip with our forceps. So you first put the forceps, do an apical grip. Apical grip means a little bit of apical pressure, and then you do the movement. Okay. Most of movements are buccal and then lingual and then rotation, except for upper centrals, tooth number 1, 1, 2, 1, you do only rotation with an apical grip and rotation and take it out. For lower second premolar, the tooth number 4, 5 and the same for 3, 5, you do also apical grip from maybe 9 o'clock position here, apical grip and rotation also. So upper centrals, lower second premolar, we do only rotation without doing buccal and lingual. All the other teeth, we do buccal, lingual, then rotation. Another exception is the lower second molar, which is lower 7s. We do usually first lingual, then buccal, then rotation for lower 7s. Okay, so that's all for, so apical grip, then buccal, lingual, then rotation, or apical grip, rotation, or apical grip, lingual, buccal, then rotation. So these are the 3 possible movements, depends on which tooth you are doing. Last point, which is the finger support. Also, this is very important when you do extraction, that the left hand should be supporting the bone surrounding the tooth. And in some areas also on the bottom, we are supporting the jaws. So here for the upper, when we start from the upper right side, quadrant 1, we do finger support with these 2 fingers. Okay, the thumb and the index, one on the buccal and one on the lingual, and then you apply the forceps. Just will grab the forceps on this one. You apply the forceps this way while you are supporting. While you are doing the movement, you are supporting also there. You can maybe hold the other fingers. I usually do that not to be on patient eyes. I fold my other fingers to be like bent together, but that's all right. It's not a big issue if you do that, but it is more important that you put 2 fingers to support. If we are doing upper anterior, you do it this way. Still we are with the same index and thumb, and the same for the upper left side, index also and thumb. All right, so this is for the finger support for the upper. When we come into finger support for the lower, we go a little bit on a little bit different, because here on the lower left we use 3 fingers. So 2 fingers, the index and middle finger, will be supporting buccal and lingual, and the thumb will be supporting the jaw. Okay, so buccal and lingual here will be supporting this buccal and lingual plate, and the thumb will be supporting the jaw underneath. And then you can do the extraction. When you do lower anteriors and lower molars, as we said, that you need to come from behind the patient 11 o'clock position. So you need to get your hand around the patient, not resting on the patient. So around the patient and get from behind. You have also here the index and the thumb, and 3 fingers will be on underneath the jaw. Okay, so again here, this is the position that we should be doing for lower anterior, and nearly the same also when we go into the back. You are just shifting your fingers here, doing thumb and index and 3 fingers to support the jaw. All right, so these are all about this task. It doesn't take much of time in the exam, so they will just see if you are aware of what you are doing. It shouldn't take, maybe it just will take maybe 2 to 3 minutes to finish. So it is an easy task. You shouldn't worry much about it. I hope this video today helped you in your preparation for the ADC practical exam. If you have any questions, please let us know, or you can ask Apeiro team. You can check also my page, ADC Pass, or my group on the Facebook ADC Pass group. For upcoming courses also, you can ring us on Apeiro to see when will be our next course. Thank you very much. See ya.